How did salty babies lead to cystic fibrosis discovery? Imagine a tiny baby being kissed on the forehead and tasting something unexpectedly salty. This simple observation, made by parents and caregivers over centuries, was actually a crucial clue in understanding a complex disease called cystic fibrosis. For a long time, people noticed that some infants had skin that tasted unusually salty when kissed, and folklore even suggested that this might mean the child was ill or cursed. While these stories seemed like old wives' tales, they pointed to a real and important symptom linked to the disease. In the 1930s, a doctor named Dorothy Anderson performed autopsies on children who had died from severe malnutrition. She found that their pancreas, an organ vital for digestion, was filled with cysts and scar tissue. She named this condition cystic fibrosis of the pancreas. But at that time, doctors didn't fully understand why these children had such problems or why their skin tasted salty. The connection between the salty taste and the disease was still a mystery. The breakthrough came in the late 1940s during a hot summer in New York. Dr. Paul Dyson-Agnesi noticed that children with cystic fibrosis often became dehydrated and that their sweat contained very high levels of salt, especially sodium and chloride ions. He hypothesized that this salt imbalance was a core feature of the disease. To test this idea, he developed what is now called the sweat test. This simple, painless test measures how much chloride is in a person's sweat. It quickly became a reliable way to diagnose cystic fibrosis and is still used today. This discovery revealed that the abnormal salty sweat was caused by defective ion transport in sweat glands. Normally, sweat glands reabsorb chloride and sodium ions as sweat is produced, but in cystic fibrosis, these channels don't work properly. As a result, too much salt is lost in the sweat, making the skin taste salty. This defect in ion transport isn't limited to the skin. It also affects other parts of the body, like the lungs and pancreas, leading to thick mucus buildup and problems with breathing and digestion. In essence, the early clues from salty-tasting babies helped scientists understand that cystic fibrosis is a disease caused by faulty ion channels in epithelial cells. This understanding led to the development of diagnostic tools and opened the door to research on the genetic causes of the disease. Today, knowing about this salt imbalance helps doctors diagnose and manage cystic fibrosis more effectively, improving the quality of life for many patients. Remember, if you or someone you know shows signs of cystic fibrosis, it's important to consult healthcare professionals for proper testing and care.